Hi, I am Dr. Madhu, surgical oncologist and robotic surgeon from KIMS Hospital. Today we are going to discuss implications of COVID on cancer management. This is a crucial issue that has to be addressed. Most of the patients diagnosed with cancer are reluctant to take treatment because of the high incidence of COVID in the society, and most of the affected patients are also stepping out of the management of cancer. Both are important. The COVID patient, for a COVID patient or patients, cancer patients surrounded by COVID patients, the apprehension may be understandable, but both are important. You can't neglect cancer management just because of the COVID incidence. The things can be addressed in such a way that a COVID patient can be managed in a separate block, separate ICU, and at the same time enhancing the management of cancer. Nothing should stop us from treating cancer. Now the things are so much equipped, and the hospitals have isolated COVID patients and non-COVID patients. Not even single person in the society who got affected with cancer should not have any apprehension of the COVID development or post-treatment COVID. So the incidence of cancer is shifting more towards an advanced stage cancers detected because of negligence from the patient side or unnecessary apprehension that COVID is more dangerous than cancer. Whatever the things that have to be done, for example, precautions need to be taken. Let us take precautions like wearing masks, social distancing, frequent hand sanitizing, and avoid going to functions. All these things, if they are taken care of properly, automatically he is protected. And already there is vaccination going on. Most of the people have completed 2 doses of vaccination, and certain little amount of precautions are enough for a patient, for a cancer patient to get protected. So that should not hinder from taking any treatment of cancer, because it is going to allow the cancer to progress, and most of the patients who are in a treatable phase are going into palliative care management. So these things are not acceptable, and lack of awareness in the society is creating this havoc. Let them take an appropriate decision, take proper precautions, and protect themselves, and take the cancer management simultaneously, so that all the things will be done in a balanced way. The other thing which I want to discuss regarding this COVID and cancer is any patient who is undergoing surgery. Suppose if the patient turns out to be COVID positive, he should not be declined treatment. He should not be declined treatment. He should be treated in separate wards, COVID wards or COVID ICUs. If something is needed to be done urgently. Suppose if it can be postponed for a week or 10 days, we can wait. 1 week, 10 days is not going to make a big difference to the patient or to the surgeon who is treating the patient. So according to the type of the cancer the patient is having, the treatment should be tailored, and these things have to be structured in such a way that everybody is getting optimum treatment in respective departments, and at the same time the patient is protected both from the COVID and cancer. And we have almost, initially we were reluctant to do laparoscopy and robotic surgery in a patient with COVID positive patients. Now with slowly the things getting settled, we are organized in such a way that we are continuing to do laparoscopy in COVID patients also, taking adequate precautions, and everybody wearing proper PPE kits, masks, face shields, and double protections. All these things we are taking proper care and giving appropriate management to the patients. So all these things are happening. Definitely COVID is a surprise for the public, and this is creating more anxiety in the patients, which is actually not there, which is not the truth. They need to take the treatment, and adequate precautions are needed. If you suppose don't take precautions here, and if you don't take treatment here, you should not think that you are protected. You may get infected somewhere else. You may go to some gathering and you may get the infection from there. You may get the infection from your housemates. All these things are a possibility. So let us be careful in all the sections of your life. For example, you go outside, you meet with the people, you get up in the morning, you go for the treatment, whatever it is, the section or a departmental facility, you need to be very careful in all the aspects, then only you can be protected. You can't be careful in one particular aspect and you cannot neglect in the other area. So things have to be standardized, and appropriate treatment has to be taken for the COVID and for both the cancer and COVID, and you should not neglect cancer just because of the high incidence of corona. So these things are now a regular things. They are not the new things, and the treatment faculty, surgeons, the staff in the hospital, anesthetists, all are well trained to treat COVID patients. So nothing should stop us from taking treatment of cancer even during this pandemic. Thank you.